Hi everyone, I'm Dr. Priya Ranganath. I'm a clinical geneticist working in Apollo Hospitals, Bangalore. Clinical genetics is a very specialized branch of genetics. It deals with inherited disorders and rare diseases. These rare diseases do not only occur in the childhood period. These start right from the pregnancy. So in pregnancy, we see things like recurrent pregnancy loss, children anomalous scans which can be present in pregnancies, IUGRs that can be there in pregnancies. And then this can then go on to the childhood period where the child is having multiple malformation syndromes, is having a metabolic disorder, or child is having ICU admissions for some suspected genetic etiologies, hematological disorder, liver disorders. These can also very significantly affect childhood and learning stage, where you think about intellectual disability, autism spectrum disorder, which you see a lot of children with today's generation, to somewhere in the adult onset, we have neurological disorders, ataxias and movement disorders, to cancer genetics, which could be inherited from our forefathers. Generally, we take a very detailed history, understand what is the problem is at its root, take a detailed family pedigree, understand what are the complications which other people may be suffering in the family, look at the investigations, do examination, and based on all of this above, we come to a set of differential diagnosis. From those differential diagnoses, we then recommend certain genetic tests. Now, these genetic tests could be for chromosomal disorders, when we recommend karyotype, microarray, FISH, to monogenic disorders where we do clinical exome, whole exome sequencing, MLPAs and others. So a specific test will be ordered for a specific disorders. So after making a diagnosis and recommending a test, we also tell you what entails a pre-test counseling. When to expect, where are we sending this diagnostic testing for, which lab, what is the expected duration by which you can expect the report, and what are the costs. After this pre-test counseling, we do a post-test counseling where we help you interpret this report, and based on interpretation, we recommend either surveillance strategies, treatment strategies, or additional testing in the family members, and also help you to understand if there's going to be a recurrence of this disorder in the next pregnancy.